it's a good group, and but what we have to do is we have to, just before we go any further, Alex was trying to get away without us noticing, but we have. And I understand, Alex, this will be your last RAP committee.
That is correct.
So we've snared you. So I do think that, well, certainly I want to say a few words, and one or two others might want to. So I do think it warrants us just taking a moment here. I joined the committee in 2019, and clearly Alex was already here and had been here, I think, from the outset of the integration process. And I suppose I'm just trying to think, well, what would I say just now? And one of the things that we're always encouraged to remember is that we're about assurance and not reassurance, i.e. we want evidence as well as words. But clearly over time, some of that assurance is evidence of how people conduct themselves. And so it comes through people and the history of what we receive and how it's handled in the, I was going to say cut and thrust, but it's not like that in this committee, in the discussion that we have on issues. So Alex, you've been exemplary in all of that, and provide that a degree of assurance through how you've conducted yourself in the short time I've been here, and from what I hear, through the whole piece. So a thank you from myself in what you've done, and I would wish you all well for your new role, which obviously won't be too far away from where some of us are. So thank you very much on behalf of the committee for that. I'll just open it up in case one or two others just want to say a few words, and then we'll get the committee going. Would anybody else like to just come in just now?
John, I'll come in. Totally agree with what you've just said there, and I think Alex has been the Chief Finance Officer, but also Deputy Chief Officer in recent years, and that's been such a critical role, particularly as Sandra's remit has widened, and he's been outstanding in both those posts, and we've really relied on Alex, and I think he's shown great leadership, he's shown patience and real kindness as well, which is probably not something that you maybe first of all think is in the job description for a Chief Finance Officer, but I think that's one of Alex's real strengths, is his patience and his kindness, as well as his technical abilities. So yeah, thank you, Alex, for all you've done. We'll really miss you, but you've left the IJB in a really good state of affairs for someone to come in and keep things going. But thank you very much.
Yeah, thank you, Luann. And John to come in.
Yeah, just to say that under the Council Code of Conduct, I'm supposed to express confidence in all our officers, but notwithstanding that, in terms of the advice we get from Alex, I've always felt really, really comfortable and confident in the advice that he gives us. So the IJB's loss will be NHS Grampian's gain, and I'd like to just wish Alex all the best for the future.
Okay, thank you. And clearly, one important part of leadership is building the team around you, and then having that resilience so that we don't miss you too much, i.e. and we do have a really good group of officers who work around the committee. And what I was going to ask was, because Martin's here for the first time, and if there's any others that are coming in to observe for the first time, can I ask each of the officers to just introduce yourself and your role, so that will help Martin just clue into to the wider group. Okay, well, thank you very much for that, and let's move on. Emma, do you want to just check in terms of attendance and the quorum, please, and any apologies?
Thank you, Chair. We have apologies from June Brown, Sandra McLeod, John Forsyth and Angela Scott. Can I just remind members that the public section of the meeting is being recorded and will be published online for public access after the meeting. Could all attendees please mute their microphone when they're not speaking? Thank you, Chair.
Okay, thank you very much, Emma. And we're just to confirm that we are quorate for the meeting.
Yes, we are. We have Luann is substituting for June Brown today, so we have 2 Aberdeen City and 2 NHS members.
Thank you very much. Okay, let's move to item 3.1, the minute from the 26th of April. That's pages 5 to 12 of the pack. Can I just take that for accuracy first? Are there any points of accuracy within the minute? Okay, I'm not seeing anybody signalling. So if we can take that as an accurate record, please. We'll confirm that in a minute. If we can move to page 13, we've got the business planner. Sorry, Luann, please.
John, yeah, it was just a matter arising from the minute. We had circulated the data from the Carers Support Service just recently. Now, how would I phrase it? Maybe it was my reading of it. I found it quite difficult to understand what the data was telling us from what was shared. So I'm looking for that assurance that the carer service is on track and is seeing the appropriate amount of carers for the current situation, and that there's a delivery, there's management of that service that's actively being done just now. It wasn't that the data, I couldn't really get the assurance I needed from the data. It might have been there, I just maybe wasn't interpreting it properly.
Thank you, Luann. Would anybody like to comment on that? Alison?
Yeah, thanks. Oh, the camera is on now. Sorry. Yeah, completely.
Can you state your role for?
Oh, sorry. Sorry. So I'm Alison McLeod, and I'm lead for strategy and transformation within the partnership. So yes, Luann, completely take your point there. I think what we did was we just got the information direct from the commission provider and circulated it. So perhaps what we should have done is perhaps put our own maybe a summary of our interpretation of that information before summarising it, before circulating it. So we'll make sure that that's done, and hopefully we'll have a discussion with the provider as well, and just see if there's a way that we can make that information a bit more user friendly.
Thank you very much. Can I, just before we move on, can I just check, are there any declarations of interest today in any of the items that we have? Okay, none. And we don't have any exempt business on the agenda as it is. Members content that that's okay, and we don't have anything that we want to put into exempt. Okay, thank you very much. So if there's no other matters arising from the minute, if we can go on to the business planner, page 11 of the pack. And a lot of this looks quite straightforward. It's been tidied up quite a bit. Alex, did you want to say anything on this?
No, I think it's all within there, but if there's any questions, happy to take them. Okay,
thank you. Yeah, there was a bit of work done on this just prior to the committee to tidy up timelines, etc. So are there any questions on this anybody would like clarified? Okay, I'm not seeing anybody signal. So if we can note the position with the business planner, thank you. That takes us to page 17 and the directions process report. And Amy, are you speaking to this? If you just introduce yourself, thanks.
Yes, Good morning, I'm Amy Richer. I'm a Senior Project Manager for Strategy and I have a role around some of the coordination around the committees. So I've prepared this report from some of the feedback we had at the previous RAPC around the understanding on directions. So directions are, as noted in sort of 0.3.1 there, responsibility of the IJB. We're obliged to issue directions to our partners under the Public Bodies Joint Work Scotland Act, in line with our integration scheme and legislative framework. Usually this is related to financial commitments, so commissioning or procurement. And the tracker, the purpose of the tracker is to assure the RAPC that these directions have been issued and the status of the directions. Feedback from the previous meeting, I think raised initially by Luann, was that the two levels that we had on the tracker in terms of complete and ongoing perhaps didn't provide the right level of detail around the status of the directions, and also how they were presented was perhaps a little confusing in terms of the level of detail that was on the spreadsheet that accompanied the directions. So what we have within this report is a proposed RAG status for these, so red, amber, green, based on the situation of the direction that will hopefully provide a little bit more context to the directions. We have green, which is an ongoing direction which is in place and not requiring to be renewed or completed. We have amber directions, which are those which are due for completion within the next 6 months and will probably be the ones that committee members might be interested in understanding the status of those. Red directions would be those where we haven't, they haven't been implemented for specific reasons. We've got concerns about them, or those that have expired and we are not aware of what has happened with them, which hopefully we will not be in a situation we have many of those, but it allows us to see them. And grey directions would be those which are completed, are not required going forward. So we would be moving them to that level and then kind of having those as completed. You'll see in the appendix that we've got an example of what that report might look like for members, highlighting those that are red, amber, green and grey. And this is very much, this is just an example, so it's not a reflection of the existing position. We're due to report back at the next RAPC on directions, so it was to get some agreement from yourselves as members around this new approach and then apply it to the tracker for the next meeting and present that to you then.
Thank you, Amy, that was very clear. So can I open that up for any comment or questions? Luann?
Thanks, John. Thanks, Amy. Yeah, this is really clear and it's exactly what I had in mind. So thank you for doing that. It took me a minute to realise it was an example template. I was like, oh, but that aside, it was helpful to see it like that. I suppose my only question is there who decides what becomes red, and is there some criteria that's objective around that, or yeah, just how would that work? Thank you.
Will I come in on that one?
Yes, please.
Yes. So we do have the criteria there. I suppose there would be discussion with the lead for that particular direction around that status, and I would be probably seeking some guidance from not Alec, but going forward, Alec's replacement in terms of how we interpret that. But certainly it would be about discussing with the lead for that direction. Like I mentioned, I would like to think we're not in a position that we get those because you will be seeing the amber status ones as they're coming up. So committee would also kind of have sight of those in advance. Become in red.
Thanks, Amy. Can I just come back, John, just
Sure.
For perspective from an IJB member would be, you know, we want to work on the basis of no surprises. So I would rather see something that's red early rather than wait till it's really, you know, there's real problems. So just that would be my steer, but actually just being transparent about them and not being concerned about bringing issues here that are red. I think that would be my suggestion. Thank you.
Okay, thank you, Luann. And with the narrative column, there can be at least some indication something might be red, but it doesn't mean to say it's in crisis or anything. It can have some explanation. Yeah. Degrees of red, perhaps. Martin.
Yeah, thank you. Given that I'm new to all of this, I think that this does appear to be a very useful tool to give an oversight of business. So I think this is going to be very useful. Is it the case that this is the kind of size of the report in the future? I mean, it does encompass quite a considerable amount of information onto one page. And for example, there are details there about the associated budget in the second column. Is that there just for information, or would risks relate to the budget as well? So it's useful, but I think that it will raise, it will be an opportunity to raise questions around resource pressures and so forth. There is the example there in the example of the ADP, and we've got a report later in the papers. So maybe it's a useful pointer towards some of those reports as well.
Thank you, Martin. I didn't know, Alex or Amy want to comment?
I could come in, Chair. So I think, yeah, I mean, we have summarised a lot of information, and all that information will have been reported to the IJB, because when they set the direction further, then there will be a detailed report behind that before that decision's made. I guess as we get into that sort of process of actually monitoring how we're going to deliver on it, it becomes a challenge. So some of it could well be, it's indicated, it could well be that that's in relation to money and sometimes overspending, and potentially that the initial estimate had been put in relation to the financial resources was wasn't accurate, or had moved over time. The other area where I feel that you may end up with some reds would be in relation to workforce and to the actual recruitment of staff, because we've got such a big challenge in relation to that within the North East. I think you could find some of the projects being potentially delayed in relation to that. And I think picking up on that final point, if someone was coming forward with a red on it, certainly, I mean, there'll be a narrative within the paper, but I would expect there to be a good bit of narrative around about what we're going to do to get that red back on track again, and then to bring that back in. So we've got the outlines and the basis there. There's still a little bit more work to do on it. Once we get to use it within the sort of real environment, then that's certainly what we need to pick up on. It would be my advice.
Okay, thank you. I mean, I think it's going to be a case of getting accustomed to the process, but I do find that high level strategic overview is really helpful. Mindful that it does stimulate quite a few questions as well. But as you said, it's information that will be coming through the main board. So yeah, it's helpful. Thanks very much.
Okay, thank you very much, Martin. So it's useful to get the view from what we had as a committee, but somebody coming in fresh with a fresh pair of eyes and finding that helpful as well. And as Alex has said, the report can include further detail where that's required from this summary. Okay, Luann, do you want to come back?
Yeah, thanks, John. Just following on what Martin's saying, I would expect that the items that are read, that there will be a plan for where they're going to be looked at by the IJB. So it might not be this report on directions, but we'll be able to say, well, there is a full report coming to the full IJB on this date, or we're having a seminar on that, or there's a transformation plan. But there'll be areas of red won't just be left. My expectation would be there will be a plan around that, and we'll be cited on that.
Okay, thank you. Martin, you still got your hand up, or you want to come back? No. Yeah, and I think.
Sorry. I didn't mean to leave my hand up, but I do kind of have a further follow-up question, which is, will the various categories? It's good to have that structure of the categories, but will they be divided into, for example, resource issues, social care issues, clinical issues, or will there be further structure in there?
Alex?
We hadn't really got into the detail of providing that, but I could understand why that might be useful. So we could certainly have a think about that in terms of how that might feed its way through, or maybe put it into the kind of narrative column. But certainly, what the I mean, I think already you've kind of highlighted the main areas where we may have a difficulty in terms of implementing a direction. So I would certainly expect that narrative to be in there, but we can have a look and just see if categorisation would be helpful as well. So certainly Amy will pick that one up.
Okay, thank you. And I think as we use it, we can refine it so it's what we need for the information. And Amy, this will come to us every second meeting, is it, or what?
Yeah, I think it's on a 6-monthly update schedule. So yes,
yeah.
So the next one in this new format would come to the next meeting.
Yeah, okay, thank you very much. Okay, so if we can go to page 17, and at 2.1, we're asked to agree the process as outlined and shown in Appendix A. Are we happy to approve that? Yeah, okay, thank you very much. If we can go to item 4.1, starts on page 23 of the pack. Simon, are you here for this item?
Yes, I am. Thank you.
Okay, if you can introduce yourself and then introduce the paper, please.
My name is Simon Rayner. I'm the Alcohol and Drug Partnership Lead for Aberdeen City and Service Manager in the Drug and Alcohol Services. This paper is aimed to try and give some assurance around the recent publication of Audit Scotland report on the sector, alcohol and drug partnerships and alcohol and drug service delivery in Scotland. The Audit Scotland report, well, it's a briefing on a more substantial report that they published and sort of updates, I guess, the current progress that the government is making in relation to the acute issue of drug-related deaths across Scotland. Drug use is obviously a very hot political issue, so I think it's useful for the ADP to reevaluate itself and benchmark itself a little bit against this Audit Scotland report. So what I've tried to do is set out the report in terms of how we undertake governance locally, how we demonstrate and show the outcomes that we're trying to achieve, and how we do planning and resourcing to sort of progress the services and the strategy locally. Since this report for the RAP committee, there have been a couple of national Scottish Government developments that also sort of feed into this. So there was a parliamentary statement from the Minister, Angela Constance, in relation to developing clearer accountability for learning from drug deaths and for the progress to be made in terms of system improvements from that learning process. And the accountability and responsibility for that sitting with chief officer groups locally, and a bit of parity between adult protection processes and child protection processes. And also there has been the development of a self-assessment tool for ADPs that covers sections to do with strategic planning, financial governance and oversight of the sort of ADP in the relationship with the IJB and community planning in particular. So I understand that will be circulated within this month in June, with a return date of sometime in mid-September. So I think that depending on the questions and the points that people raised today, I would add possibly a further recommendation to the paper that I've circulated, which is that we bring back the self-assessment, the completed self-assessment that the ADP will have to undertake for the government to this committee for further assurance. happy to take any question.
Thank you very much, Simon. And just remind us that our primary concern at this committee is around the resourcing side of the service, and the policy side is dealt with primarily through the partnership arrangements. Yeah. Okay, thank you. Okay, thank you for that. And let's open that up for comments and questions then. John.
Yeah, I was just going to say at paragraph 3.9, there's a comment around the fact that we've got Scottish Government is providing lots of money, but it's in different streams, and some of the streams are not. It's not always clear whether they are one-off or recurring. And I'm just wondering, have we fed that back to Scottish Government, and what is the mechanism for feeding it back? I'm sure Scottish Government is trying to do the right thing, but if the mechanisms are making it difficult for us on the ground, we need to be giving them some constructive feedback in terms of what might help to make it better.
Yeah, so I mean, I agree. I mean, I think everybody's trying to do the right thing around this. I think that you know, I think we're probably quite well served in Aberdeen in terms of finance and the processes that we have in place. I think some of the plans that the government have had have maybe been to respond to other areas in Scotland. So there are quarterly government meetings with ADPs, and I think there has been a fairly consistent message gone back. My understanding is that there should be a letter that consolidates all the funding being produced that will come out, and hopefully that kind of addresses that point. But we haven't done anything formal as an ADP or through any of the integration structures or anchor organisations to feed that back. It makes things complicated and it slows things down. I'm not sure that at this point there's a particular risk to our delivery, because I think we have plans in place that have been to the IJB. So I think we've managed it, but I think it could have been easier, and it could be easier still going forward.
Do you want to come back, John?
Thanks. That's helpful. Yeah, I just think it's a case of if Scottish Government can do things better, and we need to tell them how to do things better, it would be good to feed that back.
Yeah, thanks, Jim. Thanks, Chris.
Thank you. Luann?
I don't know if Alex wanted to come in. Sorry.
Oh, sorry, Alex. Yeah.
Yeah, it was just to say, yeah, I take it's in relation to that point, and the best way to kind of feed that back is through the National Finance Network. So I'll certainly feed that back through that part of the process, and I'll pass a note on to the new CFO to do likewise. But I think there have been a number of small sources of funding coming through for alcohol and drugs over the last while, and we understand the rationale for that, and I think Simon put it quite eloquently that it's probably not in relation to Aberdeen that they're putting small amounts of money in and having really kind of tight rules around about them, because any money that comes into this area is invested in alcohol and drugs. But I think it's the basis behind it is in trying to support some other areas where it's maybe not so easy to do that. But certainly all finance officers in the council and the NHS always go back and just say, give us a wee bit more flexibility around about that sort of stuff. So I will certainly continue to pass that message back through the networks.
Okay, thank you. Luann?
Thanks. Helpful to see this, and my reading of it is that Aberdeen ADP is very well positioned with the links to community planning and the clear routes through to the IJB, and I think that's those clarity of the position of the ADP is not something that's standard across Scotland. So I think we can see we're doing quite well in that respect. I think the discussion about finance, it was something that Christian raised at the last ADP, was that it would be helpful for us to be able to understand the totality of the funding and the read across what's short term, what's confirmed core funding. and if possible, how it's split according to prevention and harm reduction, or whatever the right themes are, but really to get a sense of how much upstream activities going on would be helpful in future work. And I would like, yeah, it'd be good to see the self-assessment coming back here. So I've got two questions. Sorry, that's very rambly. First one is just what's is there work going on at a Grampian level where we're like joining up on education, awareness and stuff, or are the three IJB areas working quite separately, or are there any plans to do whole system? And secondly, is there any discussion nationally with ADPs about the National Care Service and how ADPs might be positioned within these new arrangements?
So in relation to pan-Grampian work, there's a number of pieces of work that are happening on a Grampian level. So one is the medication-assisted treatment standards, which the government have developed, or Public Health Scotland have developed. The requirement and the accountability for that sits with ADPs and integration joint boards, chief officers. But there are elements of that work that we want to take forward on a pan-Grampian basis. So there are certain clinical policies, for example, where rather than having 3 different versions, we want to have a once for Grampian approach to implementing that. There's also work that we're doing around drug checking processes. There's work that we're doing with Health Improvement Scotland around improving the join up between mental health services and drug and alcohol services, which is just starting. We haven't sort of publicised that. There's also opportunities to look at more regional sort of planning and commissioning around services, particularly tier 4 services, so residential rehab services, and there's the potential, I understand, for the discussion to include sort of safety and stabilisation for people who are in extreme sort of chaos and extreme risk of harm. So there are those processes in place which have kind of evolved from the ADPs and local officers sort of collaborating. I understand that there is some discussion within the North East Alliance, Public Health Alliance, I'm not quite sure the correct title, about possible prioritisation of substance use as a test of change for some aspects of work. In terms of the, sorry, does that answer that question? I'll go on to the next one. So in terms of the National Care Service, my understanding is that what was published this week, and some of you folk will know better than I do, but what was published this week was a framework for the National Care Service, and it doesn't really describe all the services that would be within the scope of the National Care Service, but that framework allows that discussion to go forward. But from the initial work or consultation result from in relation to the National Care Service, I think the view is that alcohol and drug services will become part of the National Care Service. What that means over time, I don't think I'm aware of any discussion about what that actually means in terms of operational delivery or the opportunities that it might create or the difficulties that it might create. My personal concern is that ensuring that we have still a very strong relationship with localities, and in particular areas of deprivation. I think the Audit Scotland report was quite clear that deprivation and trauma and a number of other factors are some of the deep-rooted causes for a lot of people in terms of addiction. And I think it would be a concern if we lost that community based relationship to try and engaging the most vulnerable people. But I would hope that within all the discussions that is kind of the good bits are retained in a sense.
Okay, thank you, Simon. Alex, did you want to come in on these questions?
Yeah, I mean, it's just to say that alcohol and drugs definitely will be one of the things that were within the care services. Is National Care Services, my understanding is a currently delegated responsibility. So I don't think there's, I think based on the consultation document, there was a separate section on alcohol and drugs and so on. It does mention ADPs in it, but I can't remember in what context, but I assume it's in the same context that there wouldn't be as it is at the moment. But what we'll just need to wait and see is if they do something different with ADPs, given the new setup in particular. I mean, we've worked really well in Aberdeen City to get that ADP structure and so on, and to work it within the paradigm of the current legislation and the current framework. But there may be that during this process that there's an opportunity to go and look at that, how that fits out across the country, I guess, and then that may impact on us locally. So we just need to keep an eye on that in terms of a watching brief. But certainly the alcohol and drug services, I think, will be a part of it, and then the new care boards, and they will have strategic planning and commissioning responsibility for those services.
Okay, thank you. Okay, Luann.
John, if I could just come back, I suppose that's what I was thinking about, was the ADPs, and how, whilst Aberdeen, we've made a good arrangement for the ADPs, that other areas haven't, and is there a risk that our good practice gets lost because other areas aren't working, and just what's the connect in for our ADP to show good practice and to show how we can work that? That's kind of where I'm thinking, and whether that's through the national ADP leads or not. That's where my question was coming from.
Alex, do you want to come back?
Yeah, I mean, if you speak to some people, Luann, I think people would say that was the risk of the whole care board, and the redesign is that you lose some of the good work that you've been doing locally, and then that levelling up across the country in areas where it's not been going so well then brings you down. So it is a good point in terms of not just DEDB, but also in some of the other work that we've done around about, and how we've taken forward integration in the IG and the health and social care agenda. So I do think there is something about that, and certainly if Simon's able to kind of start feeding some of that through the national network around about ADP, then that may help in relation to that particular issue, because as I say, we have done really well in terms of getting that sorted out.
Okay, thank you. And just before I bring you in, Martin, you still wanted to come in, Martin?
No, I don't think I need to. My question's been answered.
Okay, that's fine. Simon, do you want to come in?
Just to go back to the point that Luann made about seeing the full totality of spend and how it's allocated in terms of prevention, primary, secondary and tertiary sort of prevention work. I do have that information. It needs to be put into a sort of presentable form. But we also have, through the IGB, a workshop planned for later in September, where I wanted to try and take people through a little bit of our delivery plan and how we're aligning our sort of deployment of resources to try and address those sorts of issues. I don't know enough, sorry, about this committee to know if all the members or the relevant people who are here would also be involved in the IGB committee. But certainly, if it's helpful, I would be, if you also run workshops on certain topics, happy to run the same workshop again and cover that, or whether it's addressed through the IGB workshop.
Yes, I think that's fine. The people here will be on as part of the IJB workshop, Simon. So if we do it there, that would actually be ideal, I think. Luann?
Yeah. When I was thinking of totality of spend, I had that workshop in my mind, and I think we've now got a date for it in September. If it helps, Simon, John Cook and myself are meeting with Emma around the PSIP workshops, just to talk about what might come up and what IJB members would be interested in. So if it would be helpful, really happy to do that with you on the ADP one, and just give you our sense from other members about what people will be interested in. We can set that up. John, I'm volunteering you as well, but that'll be okay. Yes, thumbs up.
Okay, good collaboration there. So that's great. My one of my questions was around that element, because I think everybody is starting to look at treatment and prevention. And in here you have getting a balance between the two, and some, you know, I then say, what does that actually mean? And so digging under that and trying to model, yes, obviously we need to treat harm as it's happening, but getting into the root causes, looking at how the investment can actually shift things. So I quite, when the workshop comes around, it's just a kind of heads up in terms of the question and getting underneath that. Balance isn't, we'll split the money 50-50, it's getting underneath it to have impact across the two. So I think that would be really welcome in having that. My other suggestion is that I think this, taking this as an example with the National Care Service and the further consultation and co-design that's going to be taking place over the next period, it might be helpful for the IJB to be thinking of how it wants to play into that, because I think there are a number of good examples, and in many ways what we want to do is try to work out how to have the best of what we've got plus the best of what the National Care Service can bring in terms of terms and conditions for care staff, etc., etc. So it would be good at an early stage, looking at Luann and John Cook here, maybe think about that and then speak to Sandra and others as to how we get our head around developing that. That's not for this committee, but it's probably this committee, having had this example, can put that forward for the IJB to think about. Is that okay? So if we can go to page 23, where we've got the request to note the report, and also Simon, you're wanting, you're suggesting to us that additional recommendation here for to bring back the self-assessment paper.
Yes.
So if we can have those two as recommendations, and perhaps Emma, you can just capture that piece about asking the IJB to think about how we have some early discussion in terms of what we have now and into the National Care Service co-design. You get some better wording than that for it. Thank you.
Thank you. Will do, Chair.
Thank you. Okay, thank you very much, Simon. Can we move on to item 4.2? And we have review of Audit Scotland reports. Just before we open this up for the introduction and then the comment, at 2.1, page 29, we've got, just to clarify here, we have actually one recommendation, because as you'll have noticed, the report didn't look at further papers on audit, so that's superfluous at 2.1b. So we'll be looking at 2.1a to note the recommendation made by Audit Scotland. So Amy, are you going to introduce this, or is it Alex?
Come on, Amy.
Amy, please.
So yeah, apologies about that error in that area. But so this report is brought to you due to the need to kind of bring attention to the RAPSEEV members around relevant Audit Scotland reports which are published. So the intention would be to look for various, and you've obviously had a more specific report around the alcohol and drugs one that Simon has presented already. So the NHS in Scotland report that is attached to this was the other relevant report that we wanted to draw to your attention. So there's one recommendation within that report from the Auditor General for Scottish Government, and then there are 9 recommendations for the NHS. And drawing these to your attention, obviously, as the NHS Grampian is a parent organisation and a key partner for ourselves within the partnership. You'll be able to see the 9 recommendations that are there. There's significant detail within the wider body of that NHS in Scotland report. And they're wide-reaching. They touch on various aspects of some of the work that we do as a partnership, and we feel they're a fair reflection of the situation that was faced in 2021, and the areas that are highlighted there are part of ongoing work that we either have within NHS Grampian's plan for our future, the strategic plan, or the development of the workforce plan going forward.
Okay, thank you very much, Amy. Open that up then for comment and questions. Luann?
Thanks, Amy. Helpful to see and assuring that, you know, the bullet points, you know, there's nothing in there that's new to us. The one that jumps out for me that I don't feel that I'm clear on what the plan around it is the one about the improving the availability, quality and use of data on primary, community and social care. And I think, well, what I'm picking up from a city perspective is there's a real blind spot around general practice data in particular. So I'd be interested to understand what the plan is around, is that, you know, how does NHS Grampian have leverage into Scottish Government to try and get that improved, or what the plan is around that, because I do feel it's a significant risk for us.
Okay, would any of you like to come in on that?
Sorry, yeah, is it okay if I come in?
Please, Alison. Yeah.
Hand up, yeah. Yeah, it's data is always a sticky problem, as you know, Luann, and I'm not sure that there are any immediate solutions to it, but you'll note in the National Care Service Bill that they are looking to be able to share data more easily. Now, that will probably happen relatively straightforwardly between the social care data and health data, but as long as the GP practices remain independent providers, it's going to be difficult to achieve the same level of sharing. But that sort of single health record and some of the ambitions noted in the National Care Service should help move that agenda on.
Okay.
John, can I come back,
please?
I suppose that the data that I'm thinking of, it's not so much at patient level. I'm thinking of data that shows how GPs' time is being used, how physios are being used, what's the spread across acute presentations versus preventative work. You know, the same things that I'd be interested in all areas. And I was at the NHS Scotland conference this week, so yesterday heard about Forth Valley area and the work they're doing to draw some of that management data from the independent practices. So I just wonder if there's more we can be doing locally to get cited on that type of stuff that'll help drive improvements and also give us the assurance that the PSIP plan is actually moving things in the right direction. Not easy at all, but I worry that we just leave it and we think National Care Service will sort it. Well, that's 4 years away. So yeah, I still feel that maybe there's something that could be looked at sooner, more locally or regionally. I don't know if there's any discussions about that at the moment.
Yeah, I think obviously a lot of our attention is focused on the sustainability of the GP practices, and there's been a lot of issues with GP practices, you know, handing back contracts, etc. So a lot of our focus in primary care over the last couple of years in particular has been about just, you know, keeping the show on the road. But the Forth Valley information sounds interesting, so if there's anything you can pass on to us, we'd be interested to see that, and we can certainly have discussions with our primary care colleagues around about what could be done in the interim, now that we are hopefully beginning to reach a more stable environment within general practice.
Okay, thank you. Can I just, don't have anybody else there. So can I just ask a question about, or just it's a comment really, seeing the 9 headings here, and then obviously the overlap, as you've mentioned, Amy, with the work of the IJB Health and Social Care Partnership, and the fact that we have the portfolios and Sandra's role as our chief officer linking into partners. It does strike me that what we're going to increasingly need to look at is how the performance that we have and the activity that we have links across with partners, because it's almost like the joint effort will produce the outcomes. And I think it'd be interesting over the coming year for us to explore that through this committee as we get the reports coming in on the performance side, and we can sort of dig underneath that as to how we need to link in with partners' data, if you like, to triangulate performance and activity. I think it's also interesting, that whole point about data and then independent contractors, when the National Care Service itself is brought forward to remove postcode lotteries, and you almost have that within local areas to a degree as well. So there's possibly some aspects which are not immediately within the consultation that we need to open up, and getting data around independent contractors is potentially one of those. So it's more just comments from myself on this, but it's really helpful to have the report come to us to stimulate this. John.
Thanks, John. Yeah, and at the risk of sounding like a broken record, one of the recommendations was about communicating with the public, and I think there's a massive task to do here in terms of explain to people there are lots of areas where lots of instances where you do need to see your GP, and you can see your GP, but actually there are other times when actually it's better to see a practice nurse or a physio or something. And I just think we need to keep hammering home this message that you need, there are other health professionals, not just your GP, might be the right person to see, and just explaining that to folk.
Yes, yeah. So we just note that comment as well. One of my drums that I beat is what's the public expectations needing to be going forward, and aligning the messaging from the national side and the local side around that. Okay, Martin.
Yeah, thank you. I think it's worth repeating that point about the importance of joint working. We heard on that very theme just in that previous report about the ADP, where collaboration between services, rehab, social care, family-oriented support is a case of pooling resources at a time of diminishing public sector funding and resources. And I mean, the evidence is that the impact of that operational collaboration is more productive, and you get more, you get added value. So I think that's something that I think is quite positive actually from this report, and that it is more of an imperative, but it's not something that we should be doing because we're told, because we're instructed, or because it's, we're doing it because it actually brings professionals together around the same themes that they're working on, the same issues, problem solving, working together, and I imagine that there's job satisfaction, all of that, plus that additional benefit of saving resources as well. So I think it's a helpful audit report, and I would imagine that kind of approach will need to accelerate, though. We will need the professionals will have to find ways of collaborating even more intensively. That's all.
Yeah. Okay, thank you, Martin. And I think it's been good to see that the strategic work that's been done, Alison has brought forward, is kind of linked in across partners in that kind of, you can see, it's an independent report for this body, but you can see that those clear strands going across, which is welcome. And then, like Sir John's comment about what the public, how we communicate and what their expectations are, that needs to be a thread as well, national and local. So it's almost like us finding those threads, and then the rest can collaborate around it. Because that way we move on from fairly high level strategic intent to actually delivering on the ground. So it does feel, certainly in my 3 years so far with the IJB, that we've moved that forward quite a bit in that period. So yeah, welcome further work on that as we go forward, I think, Martin. Good. Okay, so don't see anybody else signaling here. So can we go to page 29, 2.1, and to note the report that we've got here, and if the minute can capture some of that discussion, then we will have that to reflect back on going forward. Is that okay? Yeah, thank you. So if we can go to the internal audit reports, first up 5.1, page 79 of the pack, and the internal audit annual report. Jamie, if you can introduce yourself and then introduce your report, thanks.
Thank you, Chair, and Jamie Dale, Chief Internal Auditor. So again, thank you, Chair. Public sector internal audit standards require that internal audit produce a report annually and give an opinion on the adequacy of the board's framework of risk management, governance and control. This report satisfies that requirement. However, I hope the committee will see from the level of detail in the report I've taken this further. So not only does the report give the committee my opinion, it also provides an overview of the key findings from our work in the year, where we are in terms of outstanding audit recommendations and other relevant updates for the committee. The report is also forward-looking. It provides an overview of areas we expect to focus on in the coming year, the work we'll be doing to support management in closing off audit recommendations, and also the work we've done internally to make sure our methodology is the best it can be for the IJB. I don't intend to cover off each section of the report, but if I could provide some commentary on a few sections and then welcome any questions from the committee. The first thing to highlight, and the real positive of the report, is that, in my opinion, the board had an adequate and effective framework for governance, risk management and control for the year ended 31st of March 2022. This opinion is not just based on the audits we concluded in the year, but also other assurances taken from wider areas, and I've asked the committee to focus on those. This includes our work up until the date of this report, our follow-up work, a review of reports from other assurance providers such as External Audit or Audit Scotland, and a host of other information that comes from us being embedded within both Aberdeen City Council and the IJB. The report also provides the year-end position in terms of outstanding audit recommendations, and the IJB is in a very positive position of having no outstanding recommendations as at year-end. I would just like to flag, though, at the next committee, Internal Audit will present a full report on audit recommendations follow-up, and this will provide details of our current work with management on actions, the outputs of the exercise, those recommendations that we have closed and those that remain open. The report also provides details of our post-year-end work, so that's the work that's been completed from the 1st of April to the issue of this report, and that also includes the issue of a further audit report which will be presented to the committee. And then finally from me, public sector internal audit standards also require that the internal audit opinion provides a statement on conformance with the standards themselves and the results of any quality assurance and improvement work. In previous updates to the committee, we have noted the need to address issues, the driver for this being internal quality assessments and any recommendations from external audit. And I'm pleased to confirm that following an internal assessment, we are fully compliant with the standards. So thank you, and I welcome any questions from the committee.
Thank you very much, Jamie. Can I open that up then, please? Luann?
Thank you, and thanks, Jamie. A really interesting report to read. I have two questions. One was just to understand a little bit what something meant. I'm just trying to find it. And it was about Bon Accord Care. One of the areas was looking at documenting institutional knowledge. I just wanted to understand what that meant, and then I've got another question.
So that was a report that we did during the year that was presented to this committee around Bon Accord Care, and a focus on documenting institutional knowledge. Again, I don't have the report to hand, but when we make a recommendation such as that, it's usually in instances where within organisations you have single people who do work, and if they were to leave or something were to happen, they take that institutional knowledge with them. So the recommendations we were making were ensuring that's documented, proper handovers, and any staff attrition doesn't result in negative impact on operations.
Okay, yeah, thank you. That makes sense. And my second question was on it was the bit that sorry, finding the page. It's about what's not included in it, and the what was written is wasn't cybercrime, but it was part of that. Counter fraud, I think, was the title. And I'm really aware of the increase in cyber crimes that are going on amongst organisations, and I understand the link with NHS Grampian and the City Council, but I just wondered where we sit in terms of risk, as most of our services are externally commissioned, and how we're looking at cybercrime risk for the partnership.
Thank you through yourself, Chair. So I think 2 points there on counter fraud, just to give the committee assurance. The IGB, through both the work with NHS Grampian and Aberdeen City's dedicated team, do have resources in place for counter fraud, and also as part of any review which my team take, fraud will always be something we'll consider to make sure the controls are in place. Cyber is definitely a focus going forward for both myself as part of the city audit and as part of the work with the IGB. So it's not actually included specifically in this report, but in the report to Aberdeen City on their year-end opinion, we focused that as one of the main issues for looking at next year. So hopefully the IGB could take assurance from that. And then just to give an update to the committee, I'm in consultation with the Digital Office and also other local authorities to make sure that we can do that review, if not during this audit year, but certainly the start of 23-24.
Okay, thank you. Alex?
Yeah, I just wanted to come in on the back. Well, I'd have another point to make, but I just really wanted to come in on the back of Luann's thing about cybercrime. So we have, as I think as Jamie's kind of outlining, most of that responsibility sits with the council and the NHS and the sort of relationships that we've got. But what I have done is yesterday, or it might be earlier this week anyway, I did contact the procurement team around about what assurance that we need to get from providers around about their compliance with cyber security. So I'm going to have a conversation. They're doing some work on that, and I'm going to have a conversation with them over the next week or so. The other the couple of comments I just wanted to make was just to kind of thank Jamie for bringing the report forward, and I think I quite like the format that it's been brought forward in. So I know that's a change from what was there previously. So just wanted to just acknowledge that. And then the other thing I would like to do is just kind of acknowledge the support of the wider Health and Social Care Partnership for closing off the recommendations, and that we had no recommendations left at the end of the financial year. I think we've had varying degrees of performance, but over the last 2 or 3 years, we've really got to grips with these audit recommendations and got them closed off in the required timescales. So I think a real big thanks to officers who are involved in that area of work from myself in doing so.
Yeah, thank you, Alex. And Emma, if you can capture that for inclusion in the minute, please. Thank you. Martin.
Thank you. I think this is a very marginal point, but there was a paragraph that I didn't understand at 4.2 on page 93 on staffing. I didn't understand about the 12.6 FTE and the 0.4 FTE. I don't know if that's an issue of concern or what. Is it possible to have a little bit of explanation on that?
Through yourself, Chair. Thank you, Martin. No, I wouldn't say that's a point for concern. Within the internal audit service, we have a budget or resource envelope of 13 FTE, and the 0.4 just reflects some flexible working arrangements I've agreed with my staff. So some staff finish early, start later. So when you look at it, it's 0.4. And if you notice, in previously, when maybe this updates came to the committee, that FTE actual could have been sitting maybe about 10 or 9 because of problems recruiting or staffing. But with my appointment in January, it actually took us up to the full complement.
Okay, thank you. I hadn't understood that. Thanks for that. That's great.
Thank you. Can I take us to page 89, and we've got the 2.4 areas of risk for future internal audit focus. There's been previous discussion about joint audits across partners. So we've got the 3 IJBs, we've got health board, potentially into the council. And so collaborative working and care reform strikes me as potential for some kind of joint audit. Collaborative working by definition, but the care reform in the sense of it's going to have an impact across all partners and IJBs. I'm just wondering, has there been discussions about potential joint audits? Maybe that's too wrong word, but pooling work and bringing that forward. Could you comment on that, please, Jamie?
Thank you, Chair. Yes, at the first committee I attended, that was the steer which was given, and since then I've been in discussions with both NHS Grampian, their internal auditor, PwC, and also Moray Council. So I've met with them twice now, and in July we will kick off our first joint review of information governance, information management, and that will be presented to the committee hopefully by the end of Q2. But also certainly the care reform has been a topic of our agenda and the work that we can do around sharing on that. Okay,
thank you. And then just it may be too early, but on the collaborative working, what's the kind of thinking underneath that as to what the focus would be through an internal audit lens?
Sorry, just on the scope of the review or how we would work collaboratively.
Just what it would really drill into, what it would be examining.
So the scope still being formed, sorry, but we are hoping that the first one will be an information management review, okay. And with that, a share of resources, and then certainly a cover report and bringing all 3 together that can be put to each of the committees. Okay, thank you. Martin?
Thank you. Just on that point about information management, would the I mean, I'm aware that there are that data is very tightly controlled, and rightly so, but there does come a point where in practice you do need to be willing to be more flexible, share data and information within the privacy framework. So would the review pick up any problems or issues around data sharing between organisations, which can legitimately prevent joint working, but then on the other hand can just be obstructive. So sorry to be blunt.
No, through yourself, Chair, no, I completely appreciate that. No, that's certainly something to look at as part of the view from both aspects. So making sure there are the correct controls in place and only those who need to see the data are seeing it, but also making sure there's that collaboration element, to get the best. When we do our testing, we'll limit ourselves mostly to our individual areas, but certainly, like I said, the cover report will bring the lessons from all three organisations.
Okay, thank you. I mean, I think that an audit of information management is really important, because out of that there might come recommendations for improvement. So I think this should be quite positive.
Thank you. Alex?
Yeah, I agree with just about everything Martin said there in terms of information and how it's being used within in the rules and so on, and how that's being used. So certainly in relation to that audit, I do feel that there needs to be an inference for improvement, and how we can help to share information more easily and efficiently, because I mean, we've kind of talked about information governance already today on our data on a couple of occasions, and it is an area that can actually hold back partnership working, but can actually hold back supporting the most vulnerable people, because we don't have access to all the information that's in all of our systems and we can't get it into one place. So certainly, Jamie, when you're looking at that one, I really would like to see a kind of focus on that coming back, because I think whilst you might get into a sort of discussion about, okay, I'm the data owner here or I'm the data owner here, if you're doing it across the whole of Grampian, then there may be differences in practice across that piece. And if we can try and get everybody to the same place, then that might be helpful in terms of moving forward some of those issues that I know the officers are dealing with on a daily basis.
Through yourself, Chair, if you don't mind, just to come back to both Martin and Alex, absolutely, like I said, the scoping is still being concluded, so I will feed all of that in. Okay,
thank you. So, okay, that's your report. I would agree with Alex's comments about the presentation of it. I found it really accessible and informative, and I think that's been a good discussion that it's prompted as well. So if you can take those comments back, and we look forward to the work through the year coming. What I'd like to do is take the next report and then take a short comfort break, if that's okay with everybody. So if we can finish the internal audit reports by taking the next one, 5.2 starts at page 95 of the pack, and this is your report on IJB performance management reporting. Jamie, if you can introduce that first.
Thank you, Chair. So the object of this audit was to provide assurance around the reporting of data regarding service performance and the delivery of the IJB strategic plan. So I'm pleased to say that our conclusion from the review is that in general, data was accurate, available and being used by the IJB regularly. However, as you know, with many elements of operations due to COVID-19, there's been less oversight of aspects of the strategic plan than originally intended. So across the review, we made a series of recommendations around the data and the performance management, and formally a restart of a focus on the back of kind of COVID-19. And I'm pleased to say that management agreed to all actions and have put in place a time-bound action plan to return to regular reporting and a focus going forward.
Okay, thank you. Open that up for comments and questions. Yeah, I think Luann.
Thanks. It's maybe more a question for Alison or Alec. Just wanted to understand, has this audit report made a difference, or were the plans already? Was it already all recognised and in progress? I suppose I'm just kind of wondering if this has created additional actions, or were you already aware and on it, as it were? Thank you.
Alison.
Thanks. Yeah, in general, I think most of the recommendations that were highlighted, we were already aware of perhaps slight shortcomings, and as mainly Jamie highlighted, that a lot of that was due to the COVID response and us not being able to focus on it as much as we might have wanted to. So in general, yeah, there was no surprises. We were aware of all of it. I think Jamie probably did challenge us a little bit more than we anticipated in one particular area. You know, we tend to, you know, the data that we use comes from information sources, mainly from our two statutory partners, from Aberdeen City Council and from NHS Grampian. So it's their systems, their data sort of thing. So I think one of the recommendations is challenged us to take a little bit more ownership of that, quite rightly. So I think not that it was a huge surprise, but I think that would be the only element of the entire audit report that that we thought, oh, okay, we should be doing a little bit more there.
Okay, thank you for sharing that, Alison. That's helpful. And again, Alex will be at the other end of this for one of the partners, won't he? Yeah, thank you. Okay. So I don't see anybody else signalling, and again, very clear report, and good to see the scrutiny of that, and then the action that's coming through. And I think for us as a committee, as we are kind of standing back, the full focus around our performance, when we get the next report on that, which I think will be at the next committee, will it, Alison? Yes. So I think we need to just sort of take stock at that point and get ourselves back in gear, because we have taken a kind of lighter touch through the COVID period, understandably, but welcome that at the next committee to do that. And so it's a timely report for us to see. So can we go to the recommendation at page 95? And oh, my document has scrolled all the way back to the start. Sorry, can just bear with me while I get us back to page 95 on mine. Yeah, so the recommendations are quite straightforward. We've discussed and commented on the issues within the report. Are members satisfied we've given it the scrutiny it requires today? Okay, thank you very much. So can we just take a short break? It's 11:17, 11:18 now on mine. Can we come back sharp at 11:30, and we'll commence for the remainder of the agenda?
Chair, could I just, sorry, could I just remind members to please switch off their cameras and microphones during the break, because we continue the recording, just for transparency.
Yes, definitely can do that, and see you back at 11:30. Thank you. Okay, that's us at 11:30, so I'd like to commence again. Do we have John and Martin here? Here, Martin, I see you now. Just waiting for John to make sure he's here. Okay, that's great. Thank you.
Yeah, I'm here.
Good. Okay, thank you, everybody. So if we go to the next report at 6.1, page 99 of the pack, and is it Sarah that's going to speak to this? Yep. Sarah, if you can introduce yourself and introduce the paper, please. Thank you.
Thank you. So my name is Sarah Gibbon. I'm a programme manager for the City Health and Social Care Partnership. I sit in Alison's strategy and transformation team. The paper that's here for your consideration today is an update on the implementation of the Primary Care Improvement Plan. It gives an update across all of our main services, and in the appendix includes the national template for reporting progress to Scottish Government, known as the PSIP Tracker 5 report. So the cover report itself highlights the main points of progress against each of the services, and the actual template is included at the end in its unedited format. I'd just like to open up for any questions.
Okay, thank you, Sarah. So comments and questions on the paper, please. Luann?
Thanks. Thank you, Sarah. I suppose my question, and it was connected to something I said earlier about data, is how all this activity is going on, and lots of work and lots of planning and thought into it. But what is it we're gathering to get assurance that this is improving the situation for GPs and for other staff, and also from a patient experience point of view? So that's my first question, and I've got another question. I'll just give it to you just now, Sarah. I'm interested in, so is it quite tightly focused on where the money can be spent in the general practice from PSIP? And I'm wondering what support there would be for people who are struggling with obesity in general practice, because I think that's a real link to health inequalities, and has major impacts on people's life and also on people's use of a whole range of services. So just wondered if that is included, or is there scope for that to be included? Yeah, and my first point about evidence of impact.
Thank you. So yeah, I would say that the evidence of impact is possibly quite a limitation in this set reporting template from government. It does focus largely on the funding and the workforce. Individually, I think the services are collecting kind of data on how that's impacting their service and their patients, sort of feedback that way. But I think a wider evaluation of how this is improving the GP capacity to function as that expert medical generalist would be welcomed, and it's something I think we should look to include in our local reporting.
Thanks, Sarah. I don't know if you were in the call earlier, but I'd said that there was good practice from Forth Valley yesterday, shared at the NHS Scotland conference about work they're doing. And I'm always a fan of not reinventing the wheel if someone else has got stuff working. So yeah.
Yeah. So yeah, I was at that session as well on the Tuesday.
Oh, yeah.
And so I've contacted Leslie and just kind of tried to get a little conversation with who she's been supported with on that work, so we can see what we can perhaps pinch with pride and learn from our colleagues on in that respect.
Great, thanks, Sarah. And I'm just wondering, is there anything that we could be doing from a Grampian perspective with NHS Grampian to raise this as the data issue at a Grampian level? Is that something that would be a supportive action that the IJB could take, or do you think there's enough going on at officer level? Just a genuine question.
It's a good question as well. I think at this stage there's probably enough going on at an officer level. I think there's nuances in how the different partnerships have started delivering, and they're at different stages for the different services as well, which could add a layer of complication. But I know there's good links across our kind of primary care leads and with the PSIP programme managers as well.
Okay.
Okay, thank you.
Sorry, and Luann had a second question
Yes.
around the obesity. So I think the fund is kind of looked after by GP Sub, and they're very welcoming to kind of proposals on all sorts that could look to kind of improve implementation. So perhaps that's something that you and I could pick up outside the call, and we could work up something to take to our GP subcommittee to look at that as an option.
Thanks, Sarah. Happy to connect you with the right folk. Thank you.
And Alex?
Yeah, I mean, I think it's we have taken proposals in the past to the money and the funding is kind of tightly controlled by GP Sub in relation to what they need to because it's in relation to how the new contract and so on. So they do. They do tightly monitor that in relation to there. Now, obviously, the level of underspend is continuing to grow, and that's been held within our reserves of the IJB at the moment. So there have been some conversations at a kind of strategic level about how some of these funds could be used and but still maintain the principles of the intent of the funding and to deliver the new GP contract. So we're happy to take any suggestions back from there, but really, we're at their big we're in their hands when it comes to whether that will be approved or not.
Okay, thank you. Can I ask a question? Obviously, a lot of the focus here is about resource and about capacity and at the service end, if you like. But this is an echo of something that we touched on earlier in the meeting, which is our communication with the public and then their expectations in relation to accessing this service or the improved services. And I suppose, so this is an open question for some discussion, Rich. Are we doing enough to inform the public about what access is going to be or where they need to go, or the fact that they have a range of professionals in allied professions around this? Because I mean, there's a good story here, but we still anecdotally hear of people thinking, well, I'm not quite sure, and having a perception and then ending up in A&E. I'm overstating it slightly, but there's an element here of pulling people through or having their expectation between pharmacy, the general practice. We're talking about hubs now. Are we in a sort of danger of actually it's more complicated for the public, and do we need to do anything more at that end to really get the benefit of all of this? Alex?
Yeah, I'll just come in there, and I guess one of the so I think what you're kind of talking about is that communication strategy. Now, there is a Grampian primary care group that are looking at communication strategies across the piece at the moment, and I shared some of the information in relation to that with the chair and vice chair, but I'm happy to have a look at that and get that shared wider. There was some information on the BBC website this week as well from Emma Houghton, who's the chair of the LMC, in relation to primary care as well, and that's all being picked up in relation to this primary care strategy that we're working through. From an Aberdeen City perspective as well, we've also started up our own communications group as well. So we're feeding into the Grampian one, but also having a look at what we can do locally as well to pick up on the points that you've raised in relation to people seeing the right professional at the right time for their condition. So certainly that's something that we're mindful of and working our way through, and we can pick that up on the back of the information that we need, or the work that we need to do around about the demand pressures that primary care is currently being faced with at the moment.
Okay, and where would that come back to?
So what I would suggest is that I pass that information round the IGB members, just to kind of give some situational oversight in relation to what's going to happen, and I could also arrange for because this meeting's meeting very frequently, as you would expect, in terms of trying to move this forward, and I could make sure that we continue to get updates to you on that.
Okay, that would be very welcome, and I think yes, it's because it's all this really good work that's going on, and that piece would embed it and would get the value from it all. Okay, thank you. Sarah, you did have your hand up, but you put it down. Is that?
Alex covered everything I had my hand up for, so.
Okay, that's great. And Alison?
Yeah, I was just going to add that obviously communication is very challenging, and timing is often the key. So it's about who we tell and when we are ready to share the information. So it's as these services come online, and is it for a certain group of the population, or is it for the population so there's layers, there's different layers of communication that we need to do, and as Alex says, that there are various groups looking at this, but I think it's we're aware of the developments, but it's just around about the timing of getting the messages out. You don't want to go too soon and raise expectations across the board, but you don't want to leave it too late either, that we don't make the best use of services. So these are the kind of challenges that we've got when we're communicating new services like we're talking about here.
Yes, no, totally appreciate that, and yeah, it can be different for different groups or different GP practices, etc. But there are probably some core messages that maybe need to go in as well about people being encouraged to improve health, self-management, as well as knowing how to access, reliably the other services. So I appreciate the complexity, but it's an area that we need to invest in to go forward. Okay, thank you. I don't see anybody else signaling, so I just had one minor point of detail. The community link workers, we're just going through a kind of technical exercise of tendering that will stay as part of the package. Question? Yeah, I'm seeing nods, so that's saying yes. Yes, okay, that's fine. So any other questions on this paper before we go to the recommendations? Luann?
John, yeah, it was just to follow up on your question about the communication plan, and I suppose for me finding a home for it, so where we get oversight, maybe on a regular basis. I don't mean every meeting, but I'm just not sure if that would be at the RAP committee, or would it be the full IGB? So it might be worth just bottoming that out a little bit, because we're all talking about it at different points, so it'd be helpful to be able to say that's going to come here at a certain date, so where we have regular oversight. Yeah,
good point. Alex?
Yeah, I thought I was going to get away with that one, but obviously not. So yeah, I'll have to come back in, because I didn't actually know at that point in time. But I think what my suggestion would be is we maybe put an update into the Chief Officer report. Would maybe be the best option for that, and that means that all of the IGB would get to see it, given it appears to be an issue that's impacting on everybody. If that was acceptable, then we could link that in with Kay, who produces that report, just to make sure there's something in relation to primary care and the communication work stream in that report as it comes through.
Yeah, no, I think that's really helpful, because I think it is a kind of backdrop piece which really is important for all of these various changes, and there's going to be plenty of them going forward. Okay, thank you. So on that, if we can go to the recommendations on page 99, we've got 3 there to note the update, as in the report and the appendices. We've got a date for the workshop as well, in the diary now, and then requesting a further performance update to the committee in the spring. And when you've got unless required by exceptions, you would bring to us, it's you that would determine that there's something which is out of kilter and you'll bring that earlier. Yeah. Okay. So we're happy to approve those recommendations for this paper. Yeah. Okay. Thank you. Thank you, Sarah. If we can go on to the next paper here. So we've, hold on a second, 6.2, the signposting protocol to external services, page 115 of the pack. And Alison, I think you're going to speak to this. Thank you.
Yes, thanks, John. So I guess mainly for Councillor Gregg's benefit, I'll just go over a little bit of the background to this paper. So the rationale for this paper is in response to an observation from a member of the IGB in relation to the specific mention of an organisation within the autism strategy. And whilst that organisation was funded by the Scottish Government to provide autism services in the area, it was felt the reference in the strategy was almost endorsing the organisation, and it was perhaps misleading as the services provided would not necessarily suit everyone's needs. So we brought an early draft of the paper to the previous RAP committee, and our original approach had been to recommend that organisations were somehow vetted prior to us signposting to them. Consultation with ACVO recommended a lighter touch in this regard. They were keen. An unintended consequence of the protocol was that smaller organisations weren't disadvantaged by being unable to meet criteria for endorsement. And it was also noted that the protocol could place an unnecessary administrative burden on staff. We've therefore revised our approach to ensure that we recognise the value of the variety of service provision in Aberdeen City, and also make best use of existing information sources that list these services and give detail of exactly what services the organisations provide. Our revised approach is therefore encouraging staff, rather than referencing one organisation, that they highlight the wide range of services on offer and urge clients and patients to undertake their own research into which service is best for them. This removes any suggestion of endorsement. The protocol that's before you today is for services that the partnership doesn't specifically commission or grant fund, and it's also proposed that it's adopted from the point that it's approved onwards. So I think that's all I want to say about it. Happy to take questions.
Okay, thank you very much, Alison. And yes, you've addressed all the points that were raised in the earlier discussion, and that's helpful to give that bit of history to it. So can I open that up for any further questions around this? Okay, Luann?
Thank you. Just a quick question from me, and I suppose it's thinking of where the original issue came from, and this applies to new providers or new arrangements. So would that particular issue be picked up at review of that, so that it's looking forward, you know, which is a good thing, but it will be addressed through this protocol?
Absolutely, and the autism strategy is just about to be reviewed, so that's why we felt there wasn't any need to particularly take any action. And you know, I think it should probably have said that we're not actually trying to fix an actual problem here, if you know what I mean. That, you know, there's not been any issue. It's just, you know, that it was noted as a potential issue, so we're just putting in place a protocol to hopefully avoid that in the future.
Okay, thank you. Yeah, I think it's clear in what's being proposed here now, and so I don't see anybody else with questions to ask. So can we go to the recommendation, which is We have the protocol attached to the Appendix A, and we're being asked to approve that now, and then that would be implemented from now, Alison. So if we can approve that today, thank you. Yeah. Okay, thank you very much for your work on that, Alison. So if we can go to 6.3, and that's page 122 of the pack. And is it Amanda or Jane or both that's here today? Amanda?
Hi, yes, I'm here.
Yes.
My name's Amanda Fackerson. I'm the service manager for CAMHS in Grampian, so thank you for inviting me along today. It's just really the purpose of the report is to update the committee on the young people monitoring report for 2020-2021. We've provided a previous update at an earlier meeting, and it's just really to provide assurance to the committee around the progress in relation to some of the recommendations that the Mental Welfare Commission have made in the report. There was 3 recommendations initially in the initial report from the Mental Welfare Commission, and I'll just kind of briefly run through them and then just give the committee chair the updates from CAMHS Grampian in terms of what we're doing in relation to those 3 recommendations. So the first one was the Commission recommended work begin to explore the accessibility and provision of intensive psychiatric care facilities for those under 18s within Scotland, ensuring that they're sufficiently prioritised, resourced and supported within the Scottish Government. The second recommendations was in relation to advocacy services for individuals that were suffering with mental health difficulties within the area, ensuring that there was availability and dedicated advocacy support for children and young people with mental health difficulties locally, and making sure that that was resourced and there was provision for that. And finally, the third recommendation from the Mental Welfare Commission was in relation to education, ensuring that a child or young person who's admitted to a non-specialist ward, that there would be consideration and exploration in relation to the educational needs and the rights of education, and that should be standard care as part of care planning for young people during their stay within hospital and when they've been admitted. So just to give the committee an update in relation to those 3 recommendations. So in relation to the first one, CAMHS Grampian has been actively contributing to the scoping review of the intensive psychiatric inpatient care provision for young people in Scotland. Our clinical director within CAMHS Grampian also is the North of Scotland regional clinical lead, so is actively involved in conversations and discussions around the provision of care and working closely with the Scottish Government in reviewing that on an ongoing basis. I should also say that all of these recommendations are closely linked within our CAM service specification, and in the report it details which standards that they're linked to within our service specification also. The second update in relation to advocacy services. We're working very closely with the local authority and health and social care partnerships, ensuring that all young people who are admitted to either Royal Cornhill Hospital within Aberdeen or Dr. Gray's Hospital on an adult mental health bed have access to the same advocacy services that are available to the rest of patients within that hospital. We routinely are auditing whether young people admitted to non-specialist wards are offered advocacy services, and going forward we're going to work collaboratively with our colleagues within those services to ensure that provision and access to dedicated advocacy support is available, and also just to ensure that there are better links with the local authority and services to improve access to advocacy service, and that could be in relation to improving documentation that's on offer and also the utilisation of those advocacy services. And then the final recommendation in relation to education, which links closely to the third standard within the National CAM service specification, Within CAMS Grampian, we're continuing to monitor, consideration and explore children and young people's educational needs and their right to education as part of standard care planning when they're admitted to hospital. So we're working very closely with our education providers and all three of the local authorities to ensure that we are the young people that are admitted to non-specialist wards have an individualised, person-centred care plan where decision making on access to education and also ensuring that that's based on clinical presentation and severity of symptoms. So we're working very closely with our education colleagues in trying to think better around that collaboration. So those were the three recommendations to update the committee on today. The Mental Welfare Commission monitoring report for young people will be due out around October time. So I'm happy to come back to the committee after that report has been issued and we've digested some of that information just to give a further update in relation to any further recommendations as part of that report. Thank you. I'm happy for any questions.
Okay, thank you, Amanda. So open that up for questions. Luann?
Thanks, and thanks for the report, Amanda. Two questions. One is, and I know this isn't entirely within Grampian's gift, but is there a timescale for when there will be residential supports, but specifically for young people, and from who've got challenging mental health issues? And second question is, do we have specialist young people's advocacy in Grampian? Does that exist? Thank you.
So just to answer your second question, Luann, no, there isn't specialist advocacy services in relation to young people within Grampian. The advocacy services is a wider scope than that. That's for both young people and for adults. However, we're working closely with advocacy services to ensure that there's educational training in terms of young people and what their offer would be to those young people based on the difference that you would generally offer to an adult. So we're working closely with our inpatient specialist services and advocacy services to ensure that we promote training and learning for those young people, for those that they would be representing. And based on your first question, there currently isn't a timescale in relation to that. The Scottish Government have produced a report basing recommendations for specialist inpatient services in psychiatric units across Scotland. However, the pandemic kind of had a little bit of an impact on that. There has been Scottish Government funding in relation to various different aspects, whether that's inpatient specialist services and CAMS, and so we're working really closely with that. So I could hopefully provide a timescale at the next update, but currently there isn't one at the moment.
Okay, thank you.
Okay, thank you. Yeah, my question was kind of on the back of that, and it's maybe going to sound a bit more challenging than it's meant. So just Amanda, is that there's a lot of we will do and we need to do kind of thing, and because it's the second report on this, and us needing kind of that evidence. So as Luann's saying, right, timelines, that would be useful coming back in, and it just feels a little bit loose. So when you talk about advocacy support, page 125, they'll get the same as other people get. So it's from our point of view in terms of assurance is, well, what other people get, is that okay? And therefore what young people are going to get is going to be of that. So I think it would be good when you bring that back next time, if it can be a bit tighter in terms of here's the gap in what we're being asked to do, and specifically here we are in what's being put in place. Even if that's going to take time, just for us to be assured to get better sight of that. Is that
yes,
fair?
I can. That's fair. That's a fair comment. Yes, and I can certainly do that at the next update. Okay,
no, that would be welcome. Thank you very much. My other question was just on the October report that you'll bring. Is that a national one on the themes, or will it say anything specific about what individual areas have done?
The report is a little bit of both. It's a national report that's commissioned, so it will provide a national steer. However, it does drill down into the report, localised trending and summaries for local areas. So it's it's a national and it will drill down into specifics. Certainly from the most recent report, we know that there's been an increased trend in terms of those that are admitted to non-specialist units. However, that's an increase in Grampian. It may only be by 3, which is still relatively a low number. However, if we think about the timescales of the report, the next report that will be due out will be right in the midst of the pandemic timescale. So we may see some further recommendations and gaps in provision in relation to that. So that the trends locally for us might be a little bit more specific.
Okay, that's fine. And I think it is for us really helpful to get the periodic updates as we have, and to make sure that the agenda for often children and their mental health don't feature in the core and of the business. And I think it's really good that we get exposure to it, and so the report is really welcome from that point of view. Okay, any other comments then? Okay, can we go to page 122? And here we've got 2 recommendations. So noting the recommendations made by the Commission, and the update that we have for our local arrangements, and instructing a further update following the publication of the next report. Are we content with those 2 recommendations to approve? Okay, right. Thank you very much, and thank you, Amanda, for the input on that. Thank you. Can we go to item 6.4, which is the Justice Social Work, the annual performance report? And is it Kevin and Leslie who are here today for this?
It is indeed, Chair. Morning.
Okay, if you can introduce yourself and introduce the paper, thanks.
Yeah, thank you. Kevin Toshney, Planning and Development Manager with the partnership, accompanied by
Leslie Simpson, Service Manager, Justice Social Work.
So I'll introduce the paper, and Leslie will offer the expert commentary around the 2 appendices. This paper follows on from papers that were presented to the committee last year, namely the Justice Social Work Delivery Plan and the Performance Framework. And the committee asked that an annual update in respect of the delivery plan be brought, and also that an annual report in respect of the wider service also be written and brought to the committee's attention. And these are the 2 appendices in the paper. Obviously, in the last year, 21-22, we were still living in the shadow of COVID. And as you can see, this impacted on our operational activity. That said, as you can see from the delivery plan update, there were still discussions and developments going on in terms of particular aspects of the delivery plan. And we recognise that post-COVID, if that's where we are, then we need to be reviewing the delivery plan to make sure that all of the aspects continue to be fit for purpose going forward. The annual report has a whole service remit, as it were, provides a bit more detail. It shows what the impact of COVID was on the service and outlines some of the headlines that the service still managed to generate for itself in terms of the work that it undertakes with the individuals that it supports. And we're open to questions or queries in respect of the detail.
Okay, thank you. And Leslie, did you want to make any comment at this point?
No, just happy to take questions.
Okay, thank you very much, both of you. If I can open that up then for questions and comment. Luann?
Thanks. Hi Kevin, Leslie, really good to see the report and really like the annual report and like the headlines, and it's really helpful for us to see it in that way. So thank you for that. Just two questions for me. I was interested in what the report says about the increase in domestic violence that's been experienced, and also the challenges with the Caledonian programme around recruitment of workforce. So just to get a sense of what the plan is around addressing that, really, was the first question. And my second one was, it was on page 200 of the report. It refers to having to revert to a paper system for some of the work. I just wondered what the risks are with that and how that's been addressed. Thank you.
Right, start with in terms of the increase in domestic violence. We tended not necessarily to see an increase in domestic violence in terms of the numbers coming through in our, or into on of coming through the court and coming on to the, but because of the number of people we already have in the Caledonian system, which is the domestic violence programme, because the number of people and we had to reduce the groups, we weren't able to deliver things in groups, etc. at the time, then it's actually taken us longer to get people through that programme. So we actually have big numbers at the moment on the programme where we don't have a huge number of increase in people actually coming onto the programme, if that makes sense. And in terms of the Caledonian workforce, Caledonia is a national programme, so we have to wait till national training gets rolled out. Several people left or were promoted, have got more senior positions, who would have been delivering the Caledonian programme, but so we're losing people, but we don't have enough people coming forward to get trained. And we had a number of fairly newly qualified workers, and we wouldn't want them to be delivering a domestic violence programme until they had been with the service for at least a year, so wouldn't be trained until then. We're now in a situation where I think 3 people in that category have now been trained, so there is some improvement at the moment in terms of being able to allocate those cases. What I would also say is kind of aligned to that but separate is we have the domestic abuse team and we also have the Caledonian Women's Service. And during the pandemic, we saw more women coming back and re-referring themselves to those services. So there was women that were identifying that they needed additional support throughout that whole time. And that number continues at the moment. So we've had a fairly heavy uptick in both of those services. In terms of LSCMI, which is, for those of you who don't know, our level of service case management inventory. That's a risk needs assessment to you and I. And this was introduced, I can't remember how, maybe 5-6 years ago on a national basis as a national tool for risk assessment, risk and needs assessment of everybody that comes onto statutory supervision and justice social work. But what happened is that it was initially intended to be a national system, but it had to be distributed across all the different local authorities because they had all different recording systems. It was nationalised and taken into a national system at about November last year. But a matter of a couple of months ago, they discovered there had been glitches in the system. And so eventually the only way that we could sort it is we had to stop using the system on an IT basis, using the database, but we've had to do it manually. So people are doing that at the moment. The trouble with that is the longer that takes is that we will at some point, when they sort all the glitches, we are then going to have to re-input all this stuff manually. And now I think it's around about 6 months now, and they're still predicting it's going to be out and down by the end of August. So we're anticipating a considerable amount of work. It's already a lot of work, but even more work when we get to that stage. And that's had a wider impact on our ability to kind of deliver services, other services, as well as we could have. It's impacting, I think, also perhaps on workers' resilience, I think. Yes, and it's a big nuisance.
Okay, thank you. this is a point of quite a bit of detail, I suppose, but I'm interested in the page 201. There's the table there, and then there's some narrative leading into it from page 200. And this is the kind of improvements for people on particular factors. So I'm just interested in the way that's done and the picture that it paints. Did the assessment also look at where things had gone backwards for people, or was it only about improvement? You're on mute, Leslie.
Mute.
That's it.
It's on. We give people exit questionnaires at the end of when they've successfully completed an order, which is, and it's as intended to be to a degree a motivational tool, rather than looking where the deficits are. So looking at what improvements we've made, we would like to, by and large, we see a lot of improvements, particularly tend to be very positive. This is just recording those on supervision. We've got a whole swathe of comments, etc., and feedback from unpaid work as well, those on unpaid work, although less so over the last couple of years, obviously. What we would really like to do, and we've already been talking about it this morning, is looking at when you can see, for example, using mental health, you can see that from the beginning of the order, that people are reporting that their mental health has improved, and that's really good. And about, I don't know, 75–80% roughly, it usually is, that will say that if they had an issue before, it's improved. What I would really like to do is figure out who that 30% are for whom it hasn't improved, and look at a way in which we can do that. And it's we're looking at a charter that we're involved in, along with mental health services, looking at that at the moment, about how we gather that information and what training we give social workers who are delivering those services. And we would want to do that in a much wider way, but we're still looking at how best we can capture that information. And we had hoped to be able to do it in the last 2 years, but we've been rather busy firefighting, so we're only just getting around to that just now. So by next year's report, we should be able to report on that.
Okay, no, that would be welcome. I totally appreciate that, the way that these tools are used, or to collect. You have to be careful about the motivation or anything else. But I suppose behind my question is the point that understanding that 30%, or understanding the themes that sit behind where people have gone backwards or it's stuck, it gives you really important intelligence for early intervention to tackle those themes before they become a difficulty. So if you're going to be doing some work on that, seeing that come through in future reporting would be good. I mean, clearly the work has been extremely positive and things are going very much in the right direction. So it's not me being picky, it's just helping, if you like, scrutinize that continuous improvement.
Yeah.
Okay, thank you. Any other questions on this paper? I think we can record for the minute that we welcome the continued progress, and that's evident here, and welcome that. So I'll take us to page 185, where we've got the 2 recommendations. I'm just scrolling back to that. Excuse me. Okay, so we're noting the annual performance report and noting the update that's been provided on the delivery plan. So is the committee content with that for this report? And thank you very much for the work in bringing this to us. Thank you. So that takes us to item 8.1, the confirmation of assurance today. So what we do here is I just ask the committee to confirm that it's satisfied on all the matters presented to us today, or whether there's any further consideration required at this time. Are the committee happy to confirm the assurance given today? Okay, thank you very much. So that brings us to the conclusion. So the next meeting is the 9th of August. And that's when we'll meet again. And if we can just say thank you very much again to Alex, and wish you all the very best. Thank you.
Thank you, John, and thank you as well for helping with the you know, I think we've built a good relationship in terms of how we've chaired this going forward. So or how you've chaired it and how I've supported you. So hopefully that can continue going forward in the new role. But I do think we've worked well as a committee to provide assurance, and certainly I know that this committee was looked upon as one of the best committee audit committees within the IJB sort of setting. So I think that's down to a lot of good work. And the other thing I would just kind of highlight as well, I'm really pleased that a number of officers are now presenting reports to the Risk and Audit Committee, because I think there was a point made earlier on around about reliance on one person, and certainly in the early stages it did really feel like that. But now there's that strength and depth of officers who are presenting on a frequent basis. So thank you for their support as well.
Okay, thank you. And actually, I think August is, in terms of office, is my last time chairing, and that it goes on to somebody else. So, but we'll help the handover process for the new people coming in on the officer side and for the chairing. But with that, can I just wish you all a good for the rest of the day, and thank you for your contributions today. Thank you.
Thanks, everyone. Bye.
Thank you. Bye.
Thanks. Bye.